Which of following the best next step in management for this patient? 12 years old boys brought to emergency department by grandmother due to worsening fever, sore throat, headache, nausea, being yesterday. He is up to date on vaccinations and has no chronic medical conditions. The grandmother cares that for the child after the school while his mother is at work. Boy's father um, died in leukemia 3 years ago, and his mother is healthy. Temperature is a little bit high, blood pressure, pulse tachy, respiration 14, oxygenation good. The patient awake, alert, and mild discomfort. In examination, oropharynx, pharyngeal erythema, oxidate are noted. So, erythema and oxidate. Uvula is deviated to the right and the left. Soft palate depressed down, and the patient has no pool of oral secretion, is able to swallow. There is bilateral anterior cervical lymphadenopathy, lung field RB clear and auscultation bilaterally with a good air entry. A small peritonsillar abscess is suspected. Hmm. Okay, and proposed treatment, including needle aspiration. I'll discuss with the grandmother which of following the best next step in management. Ask the patient for consent to treat. Call the mother at work to obtain the consent to treat. Obtain consent to treat for grandmother. Petition the court consent and proceed with the treatment without obtain consent. Okay, so this patient have small peritonsillar abscess and he is stable, not urgent. He's with the grandmother. He's a minor, so we have to take consent of his mother. Um, Not the patient himself because he is a minor, not a grandmother because she's not a guardian, no court because it's not emergent. Treatment without obtain, no, we have to consent any invasive surgery, so call the mother. Okay. Non-urgent here, okay. Any interventions for airway obstructions, informed and consent. We have to inform and consent. Non-emergent care because this patient's hemodynamically stable, as we see here, and not in imminent danger. So we have to call his mother, parent, or legal guardian. Yes. Even verbal or urgent consent, if urgent, even with a verbal. If the case is unstable and large abscess and closed airway obstructions and the patient is unstable, so this will be different. Emergent for the patients who need immediate intervention, such as that delay care could be resulted of or disability. Consent does not needed to obtain through a reasonable attempt. Content the parent or legal guardian should be made in the patient with suspected peritonsillar abscess. In addition to the proceed without consent may include a tripod position, drooling, toxic appearance, none of which, yeah. So, which is sign of obstruction, the patient, the tripod positions, mouth open, neck and chin extended, and the trunk leaning forward to try to breathe. So, this is very important questions on ethic. Education objective in non-emergency situation, informed consent should be obtained from a parent or legal guardian prior to any medical intervention in the minor.